Ebola is caused by Ebola virus. And again, there are signs and symptoms that you need to see whether you are the one who have the signs and symptoms or you know somebody who has the signs and symptoms. Is fever, headache, abdominal pains, vomiting, diarrhea, joint pains. It would be important if you observe such kind of signs and symptoms, you rush to the hospital and ensure that you're treated. Do not go to the chemist to treat yourself. Ensure that you avoid unnecessary travels to those countries that are already having cases. You can just wait for some period of time to ensure that these issues go down, and then you can travel later. We are also conducting the aircraft wastewater surveillance at JKIA. And once we collect the wastewater, it is taken to the labs. And this to check on the pathogens that are important to our country through wastewater. Remember, this can give us the patterns of the diseases that are likely to have been imported into our country. Diseases like polio, diseases like cholera, meningitis. We are also able to check on mpox, and now we are also introducing issues of Ebola. Therefore, it is a good thing to do to ensure that the wastewater surveillance continues. The Ministry of Health is doing whatever possible to ensure that we contain and we are prepared. At the ports of entry, we are doing screening, and in JKIA especially, we have designated Gate 16 for flights that are coming from those countries that already have issues. We have also expanded the mandatory screening for 10 countries that are our neighbors. So any flights that is coming from the neighboring countries, we are also making sure that we have screened. We are in collaboration and in coordination with the authorities from the other countries that are affected to do exit screening from the destination country. So anybody, before they board the plane, they are screened, and when they land in our country, they are also screened. We are going to deploy more healthcare workers to the ports of entry as from next week. So public health officers, we are also encouraging them that they will register with us so that we are able to see where we can deploy them as soon as possible, because we need to also enhance the teams that are on the ground. We have our rapid response teams are ready. So in case of anything, the teams that are already set aside, they are ready to move very swiftly and ensure that any case is dealt with. I want to assure Kenyans that we do not have any confirmed case in Kenya. And I want to allay any fears. Please let us remain calm. We are in control and the country is under control. We don't have to have any fears as at now. We only need to be very careful on whatever that we are doing and prepared. Therefore, let us not spread rumors, let us not spread information that is going to cause panic to members of the public. Please, I want to seek the members of public that they should only listen to information that is coming from the source, and that is the Ministry of Health. Let us avoid spreading information that is unverified. And if you need to get any information, we have our number 719 that you can also send questions and also ask questions on what you need to do should you find yourself in a tight corner. We are working very closely with other ministries that work at the border points, and the coordination is good. We will also be going to other points of entry, including sea and land, to also check the preparedness in the next few days. I also want to tell Kenyans that we also have our processes and procedures. If we find that somebody is unwell on board an aircraft, we are notified by the aircraft. Once the port health officers are notified, they come and pick the passenger from after disembarking from the aircraft. We pick the passenger or the patient, we take them to our clinic where they are checked. If they need a referral, then we call Kenyatta National Hospital where they are transferred for further assessment. Equally, we have an isolation center here at the airport. If the person needs to be isolated, then we already have a facility that can isolate individuals who are found to be unwell.